Well, hey, everybody. As you know, this at the time that I'm filming this video for you is day number 5 of the Big Steps 2,301K Cowtown versus Beantown Challenge. Now, we've already completed the challenge, really, of getting from Boston to Kansas City and vice versa. But the challenge isn't over. This is a 2-week competition. And so what we've decided to do, since you guys are all so amazing and have supported this so well, we've turned this into, instead of which city can get to the other side fastest, who can do the most miles in the 2 weeks that we have set out here. So there's still a long way to go, and you can get people to register and sign up, and we want you to do that. And one of the things we're doing in conjunction with this competition is really trying to help bring to the forefront why we're doing all of this and what the cause is and how we can help make the world a better place in honor of our beloved friend Sean Biggs, who grew up in Kansas and then lived his adult life after college in Boston in a suburb called Needham, Massachusetts, for the rest of his life until cancer took him away from us. So one of the things I've done already is I've done a conversation with the president of the KU Cancer Center, Dr. Roy Jensen. You can find that on our Facebook page and all of that. He gave us some great information about what's going on at the KU Cancer Center. And now I'm going to talk to somebody on the opposite side of the race here, over on the Boston side in Needham. We've been doing this race in Needham, Massachusetts for just as long as we've been doing the one in Kansas City, by the way. And the money we raise there, a lot of it goes to a hospital and a cancer center in Needham specifically called the Lank Cancer Center. And joining us now is Kelly Bodio Downey, who is the medical director of the Lank Cancer Center in Needham. Kelly, thank you so much for joining us. How are you?
Good, thank you. Thank you for having me, Nate.
Hey, well, tell me a little bit about your role at the Cancer Center. How long have you been there? And maybe what are some of the things that get you most fired up? What are you most passionate about what you get to do every day?
Well, I've been fortunate enough to be here at the Lank Cancer Center for about 5 years now. I joined about a year after they opened, and I became medical director about 3 years ago now. So, I think it's a fabulous cancer center. I think we really aim to try to deliver kind of Boston level care, but out in the suburbs so that people can feel like they're getting the same level of care as if they went into the city, but closer to home. And I think that makes a huge impact on people when they're able to kind of continue their lives and try to have as least disruptions as possible, because we all know that going through cancer is a tough enough battle as it is.
Yeah, go ahead.
No, go ahead.
Well, one of the stories I tell a lot about Sean, you can see my Big Step shirt here.
Yes.
One of the stories I tell a lot about Sean Biggs that inspires me to this day is when he was trying to decide what type of cancer treatment he was going to go through. And this was 8 years ago, and his diagnosis was pretty dire. The doctors told him, optimistically, you might be looking at a couple of years. And I asked him, well, how did you decide which protocol you were going to go through? And he said, well, I went with the oncologist that told me that if I went with him, I could continue to work and run every day. And at the time, I thought, this is insane. I mean, if you only have so much time left, I can't imagine wanting to work and run every day. But you know what Sean taught me, was he never took for granted his day-to-day life. He wanted to live his life as much as he could for as long as he could. And we should all remember that, by the way, how lucky we are to get up every morning and get to live our normal daily life. And you guys are trying to help people do that to the fullest extent by being able to get the treatment without having to travel quite as far.
Totally. I'm always so impressed and humbled by patients who say that they want to try to schedule their chemotherapy in the morning so that they can pick up their kids from the school bus or attend a soccer game in the afternoon. And it just, to be able to give them that level of care so that they don't feel like they're sacrificing anything by getting care closer to home, and still allow them to be that kind of vital part of their lives and have a sense of normalcy when they're going through something that is really kind of, upended their world. I feel like that's a really important part of what we provide for the community here.
So we're doing this as well. Of course, the whole reason that the Big Steps race this year has gone virtual, and we came up with this idea of doing a competition between the two races that we've always had, is because of the pandemic. Right. And the pandemic, we know, has affected every corner of our lives. Every single person has been affected in some way, because this is a globally penetrative event. What about at the cancer center? What types of challenges have you guys encountered because of this pandemic?
I think just like you said, I've been totally humbled by the fact that this really has affected every single person. There isn't a patient or a coworker who hasn't been affected by this. And I think probably the biggest thing that it has done is really kind of changed the way that we deliver care. I think we've always made it so that it's a very kind of inclusive environment. Like patients would come with their families, with their, they'd bring their moms or their husbands or spouses, best friends, and that kind of a thing to share the news, to go over CAT scan reports, to even come to their treatment. And I think it's very different now going through COVID. I think one of the things that we've learned is we have to limit the number of people who can be in the center, who can be in the waiting room, who can come in the visiting rooms, and that's very challenging. I think we've always wanted families and caregivers to be part of the process. And so now we've had to limit it so that it's basically patients going through it alone. And that's a whole different ball game. That can make it even more isolating. And in some ways we find it even more challenging because I think it's very difficult. These are big conversations. These are, when we're talking about potential side effects and what to do at home after you get chemotherapy, what medicines to take, how to take your nausea medicines, it's always helpful to have a second set of eyes and ears. So to have to do that by video or by Zoom, it's just a little bit different. So that's probably the biggest thing that I've noticed. This whole place was designed. If you look at where we give our cancer treatments in the infusion areas for the patients, they were spacious so that we could have chairs for visitors and family members. And that's been probably the biggest thing, is that people are doing most of this on their own.
Wow, that I got to be honest with you, that's not where I expected this answer to go. In my mind, I was thinking about the logistical challenges of how do we get enough PPE for our patients and for our caregivers. And I know we'll probably get to that stuff here in a little bit,
Sure.
because that stuff's important too. But you caught me off guard a little bit, because that human part is something we can't forget, right? Like I know just for us, I have kids, and my wife and I are constantly thinking about, okay, how do we keep our kids safe? But how do we keep them mentally healthy at the same time? How much mental health are we sacrificing if we take this activity away from them, and trying to weigh those benefits? And that sounds like very similar to what you're dealing with at the hospital on a human level,
Yeah.
before you even get to the logistical part.
Yeah, it's funny that you say that, because I've almost forgotten about the logistical part. I think we've been here since things shut down. In Massachusetts, things shut down, I believe it was March 13th. And we haven't skipped a beat. We haven't closed a day. We haven't, delayed anyone's treatment, because I think the tricky part with cancer care is it really isn't elective. And it was very challenging when we were going through the quarantine to kind of try to continue that same level of care when a lot of the other disciplines and things around us weren't. We were fortunate, I think, that the hospital here we were never without PPE. I think we had the right PPE. The guidelines always changed in terms of what that was. But I'm very proud of our staff, and I think that they've risen to the challenge for that. And now it's just the new norm. Most of the time we're all in scrubs. A lot of things are done verbally. There's not as much kind of things passed back and forth. We all have masks that we wear every day. There's a screening that you go through every day. There's plexiglass everywhere. There's eyewear. And we're just very fortunate that we have all of that. And with all of that, that's become our new norm. And so the processes of getting people through and making diagnoses and getting them started on chemo, fortunately, those logistics are kind of seamless at this point. We even have protocols and processes in place for if a patient does come up COVID positive at some point during their care, how we can continue to get them treated in a safe environment, keeping them somewhat separate from the other patients, so that there's no kind of exposures or cross-contamination, so to speak, but also providing them the care that they need. So it's funny that you say that, because the logistics have become second nature to me, but the part that I worry about is more just the emotional toll on people, staff and patients, to be honest.
Well, we're dealing with human beings, and people that have lives. And like you said, it really brings it home when you talk about somebody who is receiving their scheduling out when they're going to receive their chemotherapy treatment based on when they can pick their kids up from school. That right
Right.
there, that just hits. If that doesn't hit home with you, I don't know if I can help you. And again, we're visiting with Kelly Bodio Downey from Lank Cancer Center in Needham, Massachusetts. Now, when I talked to Dr. Jensen at the KU Cancer Center, back when we started this whole thing, I kind of reached out to them because we always want to serve with the money that we raise for Big Steps. We want to serve areas of need for the two hospitals, the two cancer centers that we raise money for. And I didn't know, are there added expenses? Are there things you guys need money for when it comes to that logistical stuff? Now, what he told us from the KU side of things anyways was, look, the government's stepped in and said that all of the patients, insurance needs to cover their testing. So we can get them tested to make sure that that they're not COVID positive when they come into the facility for their treatments. But it doesn't say anything about the employees of the cancer center itself. And
Yeah,
that's a very expensive undertaking.
I'm
And you've
sure.
already had added things to your budget because of extra PPE. He told us their PPE bill's 10 times what it was
Oh, yeah.
last year. And it's not like you wrote that into the budget. Hey, there might be a pandemic this year, so let's
Right.
have 10 times the PPE that we normally do. Are those similar challenges you guys face in Needham that Dr. Jensen was telling us about at the KU Cancer Center?
Yeah, I hate to say it, Nate. I haven't ever been tested. And if I look across
Mm-hmm.
most of our staff, all of the testing is directed at patients and whatnot, but unless you're symptomatic, they're not testing staff across the board in our hospital, um, to find those asymptomatic cases. Um, so yeah, that's a very interesting point. And you're right. We haven't, all of these things that we've had to build in plexiglass and new signage, and like I said, new logistical cameras. I never had a camera on my computer. No one wanted to see me at work before. Microphones, headsets, all these things to try to incorporate telemedicine, which is such a huge part of now what we do. All of that stuff had to be kind of bought instantaneously on a budget that wasn't there. So you suddenly shifted priorities. Um, and that's been challenging. People have been incredibly generous, and I'm so grateful for that, because that's really allowed us to be able to do the things that we needed to do to keep people safe. I was so again, humbled, I guess is the best word. The first couple of weeks back in March, people would just come and drop things off. So we had women in the area there was two women who owned a nail salon, and they were closed. So they came and they brought all of their cleaning equipment. They brought cartons of Clorox wipes and things like that.
Wow.
to bring to us, because they knew that we might need them. And patients would just drop off N95 masks, and they were like, we're worried that you guys aren't going to have enough N95, so hang on to these so that your staff have them. And then there was a patient of ours also kind of took it upon himself to come up with donating iPads. So he just kind of went around to friends and colleagues and collected iPads that people didn't need, so that iPads could be given to the hospital, because when we were at the height of the pandemic, family wasn't allowed to visit, and people, unfortunately, who were sick in the hospital with COVID, potentially at the end of their lives, weren't able to see family. So they had a big drive, and they brought a lot of those devices in so that patients could have a iPad in the hospital with people on video at home, so that they could see their loved ones. And that was
Mm.
huge. So I'm incredibly grateful for the support of people in the community, because I think that we've had to come up with creative, unexpected ways to be able to continue to deliver the care that people deserve. And you're right that that's not without a cost, but we've never let cost be prohibitive in that way, which is great.
Well, and again, Big Steps, guys, that's where we come in here.
Yeah.
That's what we're about. We're gonna raise as much money as we possibly can to help Kelly and the folks at the Lank Cancer Center in Boston. You Boston folks, there is still time. Okay, it's day 5, which means I'm not a mathematician, but I think that's 9 days left in a 14-day challenge. You can still sign up and get your miles in. If you're wondering how that helps, it's $25 to register. You just log your miles. It's a friendly competition to see which city can do the most miles. You guys are behind Boston, and I'm going to do
Uh-oh.
everything I can, by the way, to make sure that we in Kansas City win. but I want you guys to raise as much money and get as many participants as possible. Because that money, 25%, we're all volunteer based. Nobody's taking any money out of this deal. It's going straight to the community to help to help the Lank Cancer Center in Needham deal with this stuff. And when you said that about you haven't been tested yet, my wife's a healthcare professional. We have a lot of friends who work in the healthcare industry here at KU Cancer Center and other places. You're not alone.
No.
And this is something that's crazy. I work in sports. Okay. This is not what I do is not life and death. What you do is literally life and death. I've been tested. I can't even count how many times I've been tested. I'm going to get tested again tomorrow. And I'm grateful for it because it gives a certain level of peace of mind to my family, sure. And to the people I work around and those things. But you have to understand the fact that things that I think a lot of us would just take for granted. I was stunned when I found out a friend of mine who works in an ER that is a COVID ER as a doctor has never been tested.
Yeah.
And it just blows your mind. And so that's what we're trying to work on here. These are the things that we're trying to do because at the end of the day, you've got a very vulnerable patient base, right? Your
Totally.
patients have to come in, but anytime they go out, they're exposed to something that can be lethal to them.
Yeah. And you wonder, the thing that would be so hard is if I ever felt that any of us were the carrier that passed it on to a patient, and so I do think of that when I hear the sports teams and how many times we've tested all the Patriots and how many times, the Red Sox and or even like the colleges, like all the colleges back in Boston, it's a huge college population and they're getting tested 2 to 3 times a week. And like I said, we have a whole staff that's been here dutifully and working hard since March, and we haven't, and it just makes you wonder, but it is what it is, and we're here to help take care of patients, and again, we're fortunate to have all the PPE to be able to feel like, God forbid, even if any of us were an asymptomatic carrier, if we're doing all the right things, you're very comfortable that wouldn't be an issue. But,
well, and again, that's what we're here for at Big Steps. That's why what we're doing is important, and that's why hopefully we can get the word out to as many people as possible. And we want to raise money to help provide testing for the caregivers that are administering critical care.
And I want to show you something too that that I know Big Steps is helping us with. Can I show you this little? Do you watch The Big Bang Theory?
I've seen it a couple times. But I don't know enough about it. So you're going to have to help me out.
If anyone ever watches Big Bang Theory, we call this Sheldon. So this is something that's been huge for us throughout the pandemic. So we take care of patients who don't necessarily speak English as their primary language. And so we have to try to find interpreter or translator services. And so we had been able to invest in one of these a little while ago. And what it is, it's not plugged in right now, but it's basically a video interpreter service. And so what you can do is if you're sitting with a patient who doesn't speak English, and I think that's very important now because, like I said, if we're not able to allow family to come in with them, they're usually the ones that would interpret for them. We're able to have a face-to-face session with an interpreter to be able to kind of conduct the visit. And what we found is that particularly during the pandemic, it was a little challenging because we only have one of them. And so we'd be running around to say, like, who's got Sheldon? I need Sheldon in room 4. And if you have a patient here who's here for chemotherapy, they're here for a number of hours. And so you want to leave that with them in case they have a question or a symptom and they need to communicate. And so what you guys have been able to do for us is you've been able to provide us a second one so that we can have one for the chemotherapy area and then one for the exam rooms where we're seeing patients. And that's just so huge for us. That just allows us to be able to take care of patients better and more effectively. So thank you for that. That's huge to us.
You're so good at this, Kelly. You beat me to it. That's exactly where I was going next, was to ask you about this fancy machine. I didn't even realize it was right over your shoulder.
Sheldon.
The whole time we were doing this interview. That's fantastic. And Big Steps has helped pay for one of those.
Yes. Yep.
Oh, that's awesome.
Yeah.
And so my final plea to those of you, look, when we started Big Steps, I can tell you personally that when Sean was battling cancer, especially me being 2,301 kilometers away, there was this feeling of helplessness. And I think we can all identify with that when a loved one has been hit by cancer. you want to do something, you want to help. And especially when you lose a friend to cancer,
Yeah.
you have this feeling of helplessness, and the foundation has given a lot of us an outlet for that feeling of helplessness. We can do something. We might not be able to do something to save Sean, but we could do something to save the next person down the road. And I know from firsthand experience with what's happened at Link and at the KU Cancer Center that somebody that's diagnosed with the same thing Sean had 8 years ago, if they're diagnosed with it today, their chances of surviving and beating it are infinitely better because of what people are doing, and the treatment, the level of care that they're getting is even better because of pieces of equipment like this and what we're doing. So Kelly, I want to thank you and all of the healthcare professionals who are going in there without getting tested, risking your own health and safety to treat people who really depend, their lives depend on the care. Because I know firsthand that these are not easy times for the people in your shoes right now. And please help us spread the word. We want to do everything we can to help you guys be able to continue to do what you do, because we need you guys. So thank you very much.
Thank you, Nate. I really appreciate everything that you're doing and everything that Big Steps is doing to be able to help us take care of patients, particularly during this, complicated time.
So if you want to help us out, you go to BIGGSteps.org. That's 2 G's, BIGGsteps.org. You can sign up. There's still time to run and walk. We'll take walkers too. It's just about how many miles you put in. Fun little competition. Maybe put your friend up to a bet too. See which one of you can do the most miles. I'm taking on Trini Kuznirik from Boston, by the way, and I'm going to do everything I can to win that competition with her. But the bottom line is we're raising money for people who could really use it. And that's what this mission is all about. So again, Kelly Bodio Downey, Medical Director of Lank Cancer Center in Needham. Thanks for the time, and hopefully we get a chance to talk to you again soon.
That sounds great. Go Boston.
And it's Sheldon, right? What's it?
I call it Sheldon, but some of my other nursing colleagues that are maybe of a different generation call it Rosie from the Jetsons.
I love it. I love it. Rosie, Sheldon, whatever it is, we thank you too. And everybody, thanks for watching, and thanks for supporting Big Steps. We'll talk to you again soon.
Take care. Thank you.